Hi, I am Van Krishna Cortez from Tusi, and I am here with my group mates, Mary Marco Borbajo, Maika Cabalida, Shanin Kabatingan, Bea Erato, Kian Fatima Iso, Precious Dayan Ortiz, and Jella Jean Rosales. And our group will discuss about metabolic disorder related to lipid metabolism, specifically non-alcoholic fatty liver disease or NAFLD. So let's begin. The liver is the second largest organ responsible for digestion, detoxification, and nutrients processing. So we all know that the liver is the second largest organ in the human body, and this is responsible for digestion, processing nutrients, producing bile, and removing toxins. And when excess fat starts to accumulate inside the liver cells, then this condition is known as fatty liver disease. Although this condition is associated with heavy alcohol consumption, studies shows that even individuals or people who do not drink alcohol can still develop fat buildup in the liver, and this is because of their lifestyles and metabolic factors. And this condition is called non-alcoholic fatty liver disease or NAFLD. NAFLD or non-alcoholic fatty liver disease is a condition in which excess fat accumulates in the liver even if the person does not drink alcohol, caused by abnormalities in lipid metabolism leading to fat buildup in liver cells. So again, this is a disorder where the fat builds up in the liver in people who consume little to no alcohol. So this happens when there is a disruption in lipid metabolism. It means that the liver cannot properly process or break down fats. So the NAFLD has two forms, the simple steatosis and the NASH or the non-alcoholic steatohepatitis. Okay, so the simple steatosis, this is the earliest stage of fatty liver disease. Only fats accumulates in the liver cells and there is no inflammation or damage to the liver tissue. So people with simple steatosis don't feel any symptoms and their liver function still works like normal. While NASH or non-alcoholic steatohepatitis, so this is a severe or more severe form of fatty liver disease. In non-alcoholic steatohepatitis, there is fat accumulation plus inflammation and there is liver cells damage. The inflammation can cause the liver scar over time or what we call it fibrosis, which may eventually lead to cirrhosis if untreated.
Hello guys, I am Mary Margux Biberbajo. I'm gonna discuss the non-alcoholic fatty liver disease. So first bullet, eating too much junk food, sweets, and oily fried foods. So when you always eat fries, chips, eating sweets, and oily food, your liver gets too much fat and doesn't know where to put it. Second bullet, being overweight because extra fat goes to the liver. If your body has a lot extra fat, some of the fat goes to your liver even if you don't want it to. Third bullet, not exercising or moving enough. So when you don't move a lot or just sit all day, your body doesn't burn a fat, so that fat stays and build up in your liver. Fourth bullet, having too much sugar in the blood. If your blood has too much sugar, like diabetes, your liver tries to help by turning sugar into fat. But then, the liver gets too fatty. Fifth bullet, having high cholesterol or high fats in the blood. If your blood has too much fat, it can get stuck in your liver and make it not work properly. Sixth bullet, family history. If your family has it, you can get it too. So sometimes you can get the non-alcoholic fatty liver disease just because it runs to your family like something you can inherit. 7 bullet. Some medicine can make fat build up in the liver. So certain medicine can make fat stay in the liver as a side effect. And that's all.
Hi everyone, today we're going to talk about the risk factors of non-alcoholic fatty liver disease, also known as the NAFLD. So non-alcoholic fatty liver disease occurs when excess fat builds up in the liver, not because of alcohol, but because of underlying metabolic and lifestyle factors. These are the risk factors. First is the obesity. So obesity is one of the strongest risk factors, especially excess fats around the abdomen. This type of body fat increases insulin resistance and promotes fat storage in the liver. Next is the type 2 diabetes. Individuals with type 2 diabetes or pre-diabetes are at significantly higher risk. Their bodies struggles to manage blood sugar, crushing the liver to store more fat than normal. Next is the abnormal lipid levels. High triglycerides and low HDL cholesterol make it easier for fat to accumulate in the liver, contributing to non-alcoholic fatty liver disease development. Next is the unhealthy diet. Frequent consumption of sugar drinks, processed foods, refined carbohydrates, and saturated fats contribute to rapid fat buildup in the liver. Next is the sedentary lifestyle. So, physical inactivity reduces the body's ability to burn fat efficiently when energy is not used. So, excess fat is stored often in the liver. Next is metabolic syndrome. So, a combination of conditions like high blood pressure, high blood sugar, abnormal cholesterol, and belly fat significantly increases the likelihood of the non-alcoholic fatty liver disease. Next is the genetics. So, certain genetics variations such as mutation in the PNPLA3 gene can make an individual more prone to developing fatty liver disease, even with mild risk factors. Next is the hormonal imbalances. Conditions like polycystic ovary syndrome and hypothyroidism can also elevate risk by affecting the body's metabolism, gut microbiota changes. So, it imbalances in gut bacteria may increase inflammation and allow harmful substances to reach the liver, contributing to disease progression. To sum it all, the non-alcoholic fatty liver disease is primarily driven by insulin resistance combined with obesity, poor dietary habits, lacks of exercise, and metabolic disorders. Genetic and hormonal factorism also play a significant role.
Hi, my name is Shanine Kabatingan and I'll be sharing the symptoms of non-alcoholic fatty liver disease. So first symptoms is fatigue. So fatigue is a persistent feeling of tiredness, low energy, or exhaustion that is not necessarily related to how much sleep a person can get. So according to G.L. Newton 2010, fatigue is very common to those people that has non-alcoholic fatty liver disease, but this is not necessarily linked to how severe the liver disease is. So even in early stage of non-alcoholic fatty liver disease patients, they can also experience very fatigue. So second is right upper abdominal discomforts. The person may feel dull ache or fullness under the right rib cage where the liver is located. So third is bloating. So bloating, it is a sensation of abdominal fullness, gas, or distension. So bloating occurs if you have slow digestion, mild liver enlargement, or association with metabolic issues. So it's often reported by patients but not always studied as a core symptoms in research. So fourth is nausea. So nausea, it is a feeling like you want to vomit, often related to digestive discomfort, and nausea can cause from general liver dysfunction, mild inflammation, or slow gastric motility. Fifth is decreased appetite. So this means less desire to eat, loss of hunger. So this can happen especially in advanced stages of liver disease, but even in earlier stages, systemic inflammation and metabolic dysregulation may reduce appetite. Six is daytime sleepiness. So this is a feeling unusually sleepy during the day. So you want to nap or difficulty staying awake. So those patients that have non-alcoholic fatty liver disease have obstructive sleep apnea. So they have poor quality of sleep and thus daytime sleepiness. So seven is difficulty concentrating. So this refers to trouble focusing on tasks, easily distracted, or finding it hard to keep attention. So this likely ties to autonomic dysfunction. So this refers to nerves that regulates our organs, which can also affect our cognition. Lastly, number 8 is postural dizziness. So this refers to feeling lightheaded, dizzy every time you are moving from lying or sitting or even standing. So that's all the symptoms of non-alcoholic fatty liver disease.
Hi everyone, this is Kian Fatima Isak, and today I'm going to dive in the science of non-alcoholic fatty liver disease. So think of it like detective work. The liver can tell us directly how it's feeling, but it leaves behind clues, and I'm here to help you spot them. So the first sign is the tiredness or low energy. So people with this disease often feel more tired than usual. This happens because the liver isn't working at full capacity, so your body can't get energy as efficiently. So the second one is the upper right belly discomfort. So you might feel a dull ache or fullness on the right side of your belly. So this is usually caused by the liver becoming slightly enlarged or inflamed. The third one is the elevated liver enzymes. So this is ALT or AST. So blood tests may show higher levels of ALT and AST, and these are signals that liver cells are irritated or damaged. The fourth one is the fatty liver on imaging. So scans like ultrasounds, CTs, or MRIs can show fat buildup in the liver cells. This is one of the main signs doctors use to diagnose this kind of disease. So the fifth one is the yellow skin or eyes, or what you call jaundice. In advanced cases, bilirubin builds up, causing the skin and whites of the eyes to turn yellow. So the next sign is the red palms. So sometimes the palms of the hands turn red. This is due to hormonal changes and altered blood flow caused by liver problems. The next one is the spider angiomas, or small red spots. This is what they call a tiny red spider-like spots that can appear on the skin. They are small blood vessels showing up because of liver dysfunction. The next one is fluid in belly, or what you call ascites. So in severe liver disease, fluid can build up in the abdomen, making it look swollen. So the next is swollen legs or ankles. So low protein production by the liver allows fluid to leak into tissues, causing swelling in the legs and ankles. So the next is hand tremor or flopping. This severe liver dysfunction can cause toxins to build up in the blood, leading to a flopping motion of the hands when extended. And the last one is the low albumin, slow clotting, or low platelets. Blood tests may show low albumin, slow clotting, or low platelets. These are lab signs that the liver isn't making proteins or clotting factors properly. So you see, your liver is one of the hardest working organs in your body, and it deserves a little love. By keeping a healthy weight, eating a balanced diet, staying active, and limiting alcohol, you can help prevent liver diseases and keep your liver healthy for the long run. Small daily choices really add up, and your liver will thank you for it.
Treatments for non-alcoholic fatty liver disease. The first one is healthy diet. Eat less sugar, oily food, and fast food. Choose more fruits, vegetables, and lean meat to protect the liver. The second one is regular exercise. Move your body for at least 30 minutes daily. This helps burn fat in the liver. The third one is weight management. Lose weight slowly and safely. Even small weight loss can improve liver health. The fourth one is avoid alcohol. Alcohol damages the liver, so avoiding it helps prevent the disease from getting worse. And lastly, regular checkups. Visit your doctor to monitor your liver and make sure the condition is improving.
Now, let's move on to the medications of non-alcoholic fatty liver disease, which includes the pioglitazone, vitamin E, and nystatin. But before that, I want you to know that there's a specific purpose and mechanism in improving patients' conditions. First, we have pioglitazone. Pioglitazone is reduced liver inflammations, especially in patients with insulin resistance. Next, we have vitamin E. Vitamin E antioxidant helps protect liver cells. And the last one is its statins, safe for NAFLD patients with high cholesterol.
Now, let's move forward with the short case study about a 10-year-old boy diagnosed with non-alcoholic fatty liver disease, or what we call NAFLD. So, in this case, it showed that the patient was overweight and had no obvious symptoms. His condition was found during a routine checkup, and then his lab results showed high triglycerides, and the ultrasound confirmed fatty infiltration of the liver. So, this highlights us how NAFLD can exist quietly even in children. For the next slide, for management, the doctor recommended lifestyle changes such as healthier eating, increased physical activity, and even fish oil supplements. However, based on the study, the child was lost to follow up for a 6 months checkup, 6.5 months. And then, when he finally returned, there were mixed results during his lab test. His triglycerides normalized and he became more active through playing basketball, but he still remained overweight. And then the doctor decided to give him a repeat ultrasound, and then it still showed a fatty liver, and a fibroscan revealed a minimal fibrosis but severe steatosis. So despite some improvements, the liver fat buildup was still significant. So to sum up this case study, this case shows that NAFLD isn't just an adult disease, it's also increasingly seen in children and often goes unnoticed. So it also reminds us that lifestyle modification is essential but can be hard to maintain without a strong family support. Early detection and regular monitoring are important because they help prevent progression to more serious liver damage. Overall, this case reinforces the need for awareness and early intervention in pediatric NAFLD. Thank you.